Now, this is from Webster's Medical Dictionary, and this is really quite simple, straightforward. It's a sheet of connective tissue covering or binding together body structures. It's a very simplistic, it's a good beginning. But this one came from the 2016 International Fascia Research Congress. Fascia is the soft tissue component of the connective tissue system that permeates all of the human body. It forms a whole body continuous three-dimensional matrix of structural support. Fascia interpenetrates and surrounds all organs, muscles, bones, and nerve fibers, creating a unique environment for body systems functioning. So in other words, it is, to me, the medium in which a lot of communication is going on from one system to another. Talking about the interrelationships, connective tissue is the interrelationship between musculoskeletal and the lymphatic system. So what are we engaging with here? So this is what we refer to as a biotensegrity representation of the body. So the harder structures could represent bone, and these are maybe the elastic parts are about attachments or muscles or ligaments. The idea is to show you that none of the hard structures, first off, touch each other, but also it's a compression tension structure, our body. So as we place force into it, we create this tension through the compressional forces or tensile forces as well. So this is just an overall simplistic view of the body. Now what I'm going to add from our perspective on oncology is we are not just dealing with this, we are dealing with a number of things. And so I'm going to add within the center and amongst this harder structure, it's all the things like your fascia, your adipose tissue, your muscles, your arteries, your veins. These are the structures that we actually do have indirect contact with. Now I'm putting this in a bag, and the bag is the representation of the external behavior of the skin. So all these structures are within our biggest organ, which is the skin. So as you can see, it's in there, it's tucked in, there we go. And the last thing I'm going to add, and let's see if this works, is the ground substance. And I'm going to use a water to represent it. But this is the representation of what we are working with as a massage therapist. So here we are, we're putting our hands on, and we are making internal contact with our hands from the outside. So we don't necessarily see what we're doing, but we can feel, and we are innervating things indirectly through the upper contact. So what we touch on the outside, the skin, we can see that we're actually affecting internally what's going on with the other structures. So we don't necessarily have to work directly on them. And this is what connective tissue does. It's like the medium in which there is this communication between the musculoskeletal system and lymphatic system. So it's looking around for things that might be going wrong in all other systems. And so maybe there's something happening in the musculoskeletal system. Connective tissue recognizes it. It talks to the lymphatic system and says, hey, come on board. Let's come and let's search and let's fix this. It's an important tissue in that it interconnects and makes everything sort of communicate between one system to another. Now, to massage or not to massage, what is our remit? One of the things that we're having to deal with in our industry, and you guys all know it, is that massage spreads cancer. It's a big myth, and it's one, even within the industry of education, that we have to change. By the end of this module, hopefully you will have a clearer idea of what to look for, and hopefully an even better one of how you can educate those around you about the truth and reality surrounding the efficacy of massage. Contraindications. You've got your common contraindications. These always will apply. Things like acute trauma, contagious conditions, undiagnosed, severe pain, uncontrolled pathologies, and a lack of knowledge. These are all typical contraindications. So if they fall under any of these categories, this is where you know that you need to stop. But when you have determined that you can't offer a massage, you might need to consider further modifications, the where, the when, how. So it is important that as a qualified oncology massage therapist that you are able to base your treatment decisions on the effects of the disease, the treatment, and the effect that it's having on the individual. These will help you to make a decision as to whether or not you're ready to go. The question that needs to be asked is, what stage of health your client is experiencing? Is it a condition that needs only a mild form of intervention, or is it terminal? You need to look at the effects of the disease, but we need to know where it is. So the fact that it might affect the lungs, or maybe it's the digestive system, or the elimination, or maybe it's somewhere in the bones. This will play an important part in helping us to make a decision as to what our treatment's going to entail. So also, not only the disease itself, but the treatment. So, for instance, with radiotherapy, and I'll talk about this in a lot more detail further on, if the beam from the radiotherapy is passing through other organs, they're going to be affected. Not just the tumor that it's targeting, but everything that it passes through. So we also have to gauge where they are within themselves, good, bad, or the indifferent. Many clients, even after they've been given all clear, they're very anxious about the possibility of cancer returning. So any small abnormality becomes a big fear. Your session's goal might simply be to decrease their anxiety, to introduce calm into their day. This can have a profound effect on a client's overall outcome and their way forward to health. So we can choose our treatments based on techniques, home care, on all the above conditions I've talked about. And then we will move into modifications. Once you feel comfortable with where they're at the moment, then you can move into what I talk about as modifications. Now, the most important thing about the things that we change about our massage is that we take on what this is referred to as called the bonding touch. So what I've got in here, a bit of a play here, is I've got cornstarch and with a little bit of water. And what this is going to do is represent the change in how we touch somebody. So if our intention of when we're working with somebody is to go in and do the hard work, like really I want to get in there and drive the heel of my hand through there, you can see from that I'm not getting anywhere. The more harder or stronger I am, that tissue is going to throw you back and throw you out. Versus what we do is we adopt sort of a melt principle. And that melt principle is about using feel, touch, to work with the tissue to allow you into the depth that it wants to work at. So if I was to just add the difference, you can see that my hand is easily sinking in, and I can move and do what I have to do. And that's simply just waiting and allowing the tissue to take you in to where it wants you to go. It doesn't necessarily mean that I'm patting somebody very softly. It just means that you need to be more mindful and get out of your head more and allow your hands to take you through. The one thing we can all agree upon is we do not massage over tumors. But what if we don't know where the location of the tumor is? Maybe they have multiple tumors and not all of them have been diagnosed. Remember, it takes 6 to 8 years to get to a size, a tumor can get to a size that can be diagnosed. And maybe your client has been having regular massages up to this point. Unknowingly, the therapist has been working over the site for years. And it's a bit like holding back a massage if you don't know if a person has a DVT or an aneurysm. You can take a history and take all the precautions that you know, but as long as you act in a manner that demonstrates you have gained massage-based information and gotten your client's consent and thereby show a duty of care, that is all that is expected of you. The benefits far outweigh the possibilities of the things you are uncertain of, and unless you are directly working on a tumor, aggressively poking about, you will not have a detrimental effect. This is one of the reasons that I believe that our hands-on skills should not be aggressive, painful, cause tissues to bruise. It is unnecessary, and deep work can be effective and satisfying without hammering into the tissue. Our depth of contact, our massage, does change depending on what intrinsic and extrinsic factors are influencing our techniques. So for instance, if someone's in the early stages of treatment, you might find that you can get a bit deeper, but as you progress further on, they might need a lighter touch and less of it. Now there is some thoughts out there that you can get to various levels in tissue that you can monitor 1, 2, 3, 4, 5. It's a good principle to look at and consider. I'm not sure you're going to be able to, as a clinician, be able to determine whether you're a level 1 or level 5. So I'm going to give you something that is probably going to be useful for you to be able to determine at what level you are actually at. So in practice, what you can do is you can just put your hands softly on someone's skin and just very lightly just move the very top portion, that's the skin portion, and you can see that I can just move the very top layer there. That might be considered like your initial, like very superficial, applying the lotion. Maybe you're going to use it for that, and it might be that this is the need for relaxation touch. Then I'm going to ask you to just kind of sink a little bit further until you get into a little bit more bulkiness in underneath your hands. So it's more the adipose tissue that you're making a connection with next. It feels a bit more spongy, and that would be considered the next layer. And then after that, I want you to sink a little bit further, and you can start to feel maybe more musculature tissue, so the harder tissue. And any deeper than that, you're probably going to hit into the harder structures like the bony areas. So what determines your choice of how deep you go? Well, the influence is going to be dependent on where they are in their treatment or their return to health, sort of even their own, what they've come to you, at what stage of health are they in, as well as what sort of treatment they're having, at what stage, it might be post treatment, many years, but it might be within a 10-session chemotherapy or radiotherapy, and therefore you would need to make the adjustments to possibly bring it up lighter. There's a great deal of research out there showing that massage has many benefits at every stage of a client's journey. My question to you, though, is what are we really affecting? Biological changes versus emotional changes. And while I think we're having that significant change biologically, physiologically, I think a majority of that change is what our clients perceive. So the hope they put into the therapy, our words that come out of our mouth, aid to the emotional experience. And I think that offers a very strong point in the success of what we do.